Hello, this is Dr. David Cruz for Whitecoat Medicine Talks again, and today we're going to continue with our talks on dementia. This is part 4, and today we're going to mention curcumin and its benefits for memory and dementia. We know how difficult it is to treat somebody with dementia and for somebody that is going through dementia, and we try to do everything possible to make it better for them. We know that the medications currently available do not completely cure Alzheimer's dementia. They do help memory for some time and let the patient function for a little bit longer period of time. But we do want to start adding other things that may help the patient and do things that will help the patient. Now, we've talked about them sleeping 8 hours, fasting for 12 hours if possible. Exercise is very important. But then we do have to talk about adding supplements. Our last video was on ashwagandha, and we know that that one helps possibly make more connections in your nerves and help with neuroplasticity. And as we go back to our first video on dementia, we talked about the amyloid precursor proteins, and when we break that down in the right place, it helps dendrites and your neurons grow and make more connections in your brain. So that's what we're going to focus on today. Curcumin, or turmeric curcumin, is a supplement you can find at your store. And what this supplement does, it cleaves the amyloid precursor protein at the alpha site also. So we're working on the correct side of the amyloid precursor protein to break it down, to make more connections in your brain, and hopefully that will help memory over time. Now, it also has been found to decrease inflammation. They do this by measuring the C-reactive protein. C-reactive protein is made by your liver, and it is a response to inflammation. So when there's more C-reactive protein, we know that there's more inflammation going on in the body. And as that comes down, we know there is a decrease in inflammation. We also know that inflammation really hurts the brain. And so by doing this, it also is helping the brain as well. Now, the dosing on this is 500 milligrams twice a day. Now, we have to be very careful of giving it to people that are already taking anticoagulants, so Plavix or aspirin or some of the other medications. So, because this does thin out your blood a little bit as well. So be very careful with that. In addition, anybody that has biliary problems, we have to be very careful giving it to those patients as well. Talk to your doctor and see if curcumin will benefit your situation at this time. Once again, for Whitecoat Medicine Talks, this is Dr. David Cruz, and thank you for listening.